Okay, now is the exciting part of the day. We're going to actually start engaging with our speakers, and you've got a really remarkable story for our next two speakers to tell. We're joined by Dr. Stacie and Logan Barber, a couple whose story really feels like it was written for the big screen and has been on the big screen, at least the TV screen in some ways. It is really going to capture your heart. It's already captured the heart of millions of people. Logan was an elite power lifter, a man who defined himself by his strength. He once lifting over 700 pounds. That is an incredible amount of weight. So that gives you an idea of how strong this individual was. Perfect health. He was in perfect health. But in September of 2024, that world was really shattered by a massive hemorrhagic stroke that left him in a coma, fighting for his life, while his wife, Stacie Barber, was halfway across the world. Stacie isn't just a caregiver, though. As I mentioned, she's a doctor. She's a doctor of physical therapy and has a renowned strength coaching program, PhysioFix. And when she got back to Logan's bedside from Australia, she didn't see just a patient. She saw a brain and a body in rehab. Her training kicked in, and she had to literally fight the hospital protocols to start his recovery on day one, refusing to wait for the traditional timeline. And she'll walk through what that is. What followed from all of that was really one of the most poetic recoveries we've ever seen. It's something remarkable although I would say I rarely see, the more I do what I do at the Neuroplasticity Alliance, stories like this come to me on a frequent basis, but hers does stand out. And the fact that she recorded the whole thing as she was going through it. So I am very, very excited for you to watch this and see that progress as Logan recovered and he was learning to regain his independence and mobility. He was following along the milestones of his 10-month-old daughter, Oakley. Logan and Oakley went through that together. So I want to welcome Logan and Stacie to the stage now. Logan and Stacie, thank you so much for joining us today.
We're so excited to be here. Thank you for having us.
Hey,
Yes, you guys have just a tremendously remarkable story. And honestly, I know I said it sounds like it's ready for the big screen, but if you think about what you guys were going through and walking through that, it does sound something like a nightmare. And Stacie, because you were so far away, and Logan, you were in Phoenix when you had the stroke. I do want to I have so many questions for you, and I know our audience is going to have so many questions for you, but I thought I would just share a short little video just to give people a preview of what that journey was like. So I want to put that on the screen right now and let everyone get grounded. Okay, that's super moving. Although you guys live that. And so how does it feel to see those videos? And you've had so much media attention. How does it feel now that you're on the back end of that side to see that and to see that journey that you've gone through?
Give me answer first.
go ahead. Go ahead.
I mean, it's crazy looking back. I always like to look back at the videos, and I am so glad that I documented everything because his progress, is remarkable. And it's cool to see how far he's come to just even in the little things. So I'm glad we're on the other side of it, like you said. But when we were in the middle of it, man, it just felt like our whole world got turned upside down, for that time period. And it was for a while. But yeah, it's been pretty cool, the journey, and to share that with others is pretty cool too.
Yeah, the inspiration of telling your story has helped so many other people. And I imagine that has to feel so good, but also a very big sense of responsibility, especially for you, Logan, right? Because you're the one who's having to go through that and you can't let your fans down. You got to push forward, you got to push through. Did you know that you were out there inspiring so many people through this process? Did you feel that?
I had no idea until Stacie actually showed me some of the Instagram videos. I'm not really familiar with social media. I stayed away from that stuff. So my recovery was the most important. But when I saw this, it still feels like a lot of pressure because there still is some recovery going on as far as getting back to my original strength. Obviously, getting older, I don't expect to get that strong that I used to hold as far as PRs and stuff like that. But yeah, there is going back to that. Yeah, it feels like a lot of pressure still.
Yeah.
Um,
Well, everybody's cheering you guys on. I can
Thank you.
assure you that. Yeah, I've gotten so many comments about the excitement to hear your story and to be able to ask you questions. So I'm sure we're going to have a ton of questions for you guys. But before we turn it over to Q&A, I did want to just get a couple of questions in on my own. So I'm going to start, Stacie, with you, if you don't mind. And when you saw your husband lying there in the bed and you've got the doctor physical therapy mindset as well, and I know you and I talked briefly that neuroplasticity was involved in every sort of movement and decision, and you had to you know walk through the hospital, walk through the physicians and the care team at the hospital of why he needed to start physical therapy right away. So I would love for you to speak to that, how your training kicked in, how you knew what to do automatically to help him. And then on the tail end of that, Logan, I'd like to circle back around and ask you how it was from a relationship standpoint to have your wife be your primary caregiver and director. So she's not only your spouse, but she's your boss in this situation.
Well, I don't know about that.
Stacie, why don't you start us off?
Yeah, so I mean, I've been a physical therapist for over a decade now. And so when all of this happened, I remember I'm not a neurophysical therapist. For those that don't know me and are just tuning in, I'm actually a sports and orthopedic physical therapist. So I work with athletes, and obviously every body is an athlete, and my husband is an athlete too. But when I first heard of his stroke when I was in Australia and flew back, I was like, oh my gosh, like I kind of felt paralyzed myself and I didn't know what to do for a second. And then once I saw that nobody was doing anything, there was no PT, there was no OT, no speech therapy, like 3 weeks in the hospital, nobody came by his room. Nobody, not one person. And so it didn't take me that long to like get the ball rolling. It was about a couple days. Once he was like more stabilized, I kept asking the doctors, asking the nurses, are you guys going to come in? Is someone going to move his body? Because I knew that early mobilization was key, to prevent, pulmonary embolisms, blood clots, like you name it. I knew that much, and I knew that, that we should start doing things as soon as possible, to help the brain recover. I just didn't know. I didn't know that I knew what to do, but no one else was doing anything. So I just, instead of continuing to ask for help, I decided to take matters into my own hands really early on. And I think it was probably like day 3, I started to do everything like myself, massage, electrical stimulation. I'd bring in all the tools that I had from my clinic. I'd bring in all of our daughter's toys just to like, have him just tinker around with them and just play around and do like, fine motor, gross motor, whatever he could do when he was like kind of like coming in and out of consciousness. And it just kind of continued from there. But like you said, I had to really advocate hard for him. They said that the policies at this hospital, and this is what really needs to change, that this policy was for people that were on a ventilator that to not get physical therapy or occupational therapy. And I said that is ridiculous because we all know that how important this is for their success. And but they said like we don't have the staff, we're understaffed. Other people take priority, which was really painful to hear that you put other people above my husband, and I know that we all think that our loved ones are like the most important, but I'm like, come on, like people need to be moving his body. He's only 37 years old. And, that's why I just decided that if no one else is going to do it, I have to be that person. And I started doing it.
Yeah, congratulations. I mean, that is the epitome of being a self-advocate right there. We had Gary Whitaker join us yesterday, who was recovering from a traumatic brain injury. And he basically had to do a very similar type approach. And his story is remarkable in his recovery, as is yours is. So I think that is really a key takeaway from our summit is that self-advocacy has to be a component of your own progress.
Mhm.
How did you know, Stacie, how to change that and alter it as he progressed? Like where to start? Was that a hard decision for you? Eh,
No, not really. Like once I just started kind of like working with him, everything felt natural. Like, this would have been probably terrifying early on in my career, but since I've worked with so many individuals, the brain is the main driver in everything that we do. So when I even think about like sports rehab, it's neuro first. You have to like work with the neurological systems and get everything to start, calming down and working the way we want it to in order to progress. So it wasn't weird for me. It just kind of felt like it was like the natural evolution. And I just kind of felt like I knew what to do. And I also wasn't afraid to make mistakes. So like, and it's my husband. So it was less pressure, what more pressure, but also less pressure than like a patient, because I was like, he was more patient with me too. And because he knew that this isn't my field per se. So he was willing to, let's try this. But also, I think that stuff, the trial and error stuff, really helped us figure out what worked best for him because everybody's different and everybody's recovery is different and their rehab needs to be different and individualized. So it was cool that like he was open to me trying things and I was just, maybe because I don't fit in that neuro rehab constraints, I was also open to trying different things too and pulling things from orthopedic rehab and sports rehab and neuro rehab and kind of combining everything that I knew, strength and conditioning, because I'm a strength and conditioning coach too, putting it all together and like just, making it more customized and individualized for him as he progressed in his recovery.
Yeah, that is so remarkable. Okay, Logan, it's your turn. What? Yeah.
Mhm.
So, I mean, I imagine there was a level of trust and confidence, right? Be from within what Stacie was telling you to do. She's your spouse, and you knew her history. But was there any ever concern on your part that you weren't up to the task? Like, shouldn't I be resting? Why should I be working so hard right now?
Absolutely. You're referring to whether I thought she would, whether I looked at her as a boss previously. At the hospital, I didn't. Everything was a lot easier in the hospital because we worked with bands and things like that. As things progressed and we went to the gym, there was a lack of confidence in self, lack of trust in self, and the workouts got harder. So it was very difficult at one point and the frustrations. There were quite a few with Stacie, but again, there was more of a lack of confidence in self than anything, and there was frustration. And being a stroke victim, a stroke survivor, however you want to call it, knowing how you previously were, where you are now, there was a lot of that's where the confidence was. You're not the same. So Stacie pushing me created a lot of frustration, but also created a lot of progress. And over that time, things have gotten easier. Granted, there are still some frustrations at points,
Mhm.
but without it, the progress would not be essential. This is in this situation, especially.
Do you think I was
So,
bossy though?
yes, yes, but definitely necessary. Definitely necessary in this whole thing.
Yeah.
Really.
I was just relentless, I thought of it as like
That's why I laugh right now.
early on, and it's hard when you're like still coming out of like all the sedation and like he had bad delirium in the hospital and all this stuff. So like when he's still trying to like come out of that state, and then you're like, no, you have to do this. Like get up. Like, we're doing this. We're getting up. But I also had rotations when I was in school in the hospital. So I was, used to those situations and like, it's going to be the difficult patient. You got to get them up and just get them moving because it's that important for their progress. And so I just thought of it like that. Like, this is my husband. I can't fail him. I'm going to do whatever. And like, he can yell at me. That's fine. But we're going to keep pushing.
Yeah, and it came through in the videos. I think there was one where you had the bands and they were tied around the hospital bed to give it some leverage. And
Mhm.
Logan, you were ready to be done. It was clear you were ready to be done.
Yeah.
And Take
Yeah.
says, no, I don't. You had to finish the count. You had to get to 15 or 5 on each side. And
Yes,
no,
ma'am.
use the hand. What's happening with that hand? Why is it still? So I could see, but it was gentle compassion, really,
Mhm.
or gentle direction there. It was not harsh. And so maintaining that tone and love, I could see it come through in those videos, but I could also see the push, right? And that brings me kind of back to neuroplasticity and emotion because emotion is really it's like cement for the brain. It really triggers those actions very much. Stacie, could you and both you as well, Logan, could you maybe identify a time where you feel like that emotion and what you were doing kicked in to really push you forward or cement an action that you were trying to achieve?
Yeah, I think that I noticed how frustrated he was, like with gait training and stuff like that. Like I know that his outpatient team and everyone stresses really hard on, high intensity gait training and like walking and the cardiovascular, like those sort of things. And I could tell that he'd won. We aren't a cardio family. We
Yeah.
don't love doing cardio. We've always been a big advocate of strength training and the importance of that. And I could just tell that it was like so frustrating to him to like have to pivot and do something that he didn't want to do, but everyone kept telling him was so important. So I could just the frustration, and then I was like, well, you know what? We don't have to do high intensity can be applied to many different things. And if you use those same principles, like we could do high intensity strength training. And so we decided to kind of pivot there and use the similar principles and methodology in just doing something that he was more wired to do from the start and something that he enjoyed more. So he was actually going to be more consistent with. So I could just, once you're like, your person, and being a caregiver or just a provider, we get to know our patients really well and you can see what matters to them and what's meaningful to them. And, when you don't do things that are meaningful to them too, I feel like they do not get better as quickly as if you did.
Yeah, I think that's a really great example of that. And Logan, how about on your end?
I think positive emotions are important, but I also think what's most important is continuity of what's going on, despite however you're feeling with it. There are obviously discouraging points from your limitations and things like that, but it's an absolute necessity to really keep going no matter what. And I really push for that to all of these people that I talk to now that are actually at Stacie's facility getting training. There are several days knowing how you used to be and where you are now and progressing from that point. This is not a simple injury, and it's something that takes a while to do. And it's something that's hard for people to come to the realization that this is not like, a broken foot or something like that, or like a scab knee or something like that. It takes time and it's a process,
Mhm.
and it's very discouraging. And those points to me are the times where I think people need to come back and keep going no matter what they need the most. Yes, I get it. Yes, there is a connection there with your positive thinking
Mhm.
and your happiest points that I think progress is made. But I think the most important points in progress are when people feeling the worst,
Yeah. Yeah.
because without it, progress has got to happen. Progress has got to be made, or else you're just
Hmm.
going to remain stagnant.
Yeah.
And I call it again, I made it before trudging through the mud. And I can't remember who gave me that, coined that phrase
No,
to
I
me.
came up with
I
it.
wish I could remember who said that. But it rings so true to me. There are places that just literally it sucks. But
Mhm.
getting through it is absolutely essential, no matter how you feel.
Yeah.
because you need that consistency. You need the continuity. And Stacie's been a pillar as far as that goes for me.
We also talk about it too. So when he's having
Yeah.
a bad day, like sometimes our physical therapy sessions turn into different types of therapy sessions.
Mhm.
We'll sit down and we'll like discuss it. And I do this with my other patients too. It's like I can see that you're frustrated. Tell me what you're feeling. Because I feel like we have our goals in mind that you need to check off this exercise and do this and get back to this. But like if you're not in a good place mentally to be able to do that stuff on any given day, it's not worth pushing. You like, let's get down to the root of what you're feeling. Maybe I can change how you're feeling within this session and make some positive impact. Or maybe, I decide that maybe it would be good for you to go talk to somebody else too, because the mental, stress of all of this and not being able to be who you used to be and drastically changing overnight, it's hard. Like I can't even imagine what that's like. And, I know what it's like for me as the caregiver, and the wife, but I don't know what it's like for people that are living it.
Yeah, and it is different, right? And we talk about that all the time because that lived experience is what's so extremely valuable. So your story, Logan, of you telling that, it comes across in a very different way as a caregiver. And you often, from a caregiver standpoint, what we hear so much is that you're so busy focusing and trying to help that individual find his path forward that you lose yourself in that. And then that creates a whole another layer of complexity on the emotional relationship that you have. That's kind of a question I have for you too. How did you maintain, you're obviously still married, you're here together. So, how did you maintain that personal bond going through that when you're at odds in a lot of cases?
As far as it goes for me, I feel like she's been the constant reinforcement of positive outlook. Um, and also being willing to help a ton. What she doesn't show is the videos of taking care of the child while I'm sitting there in the wheelchair initially. I can't do much. Um, feeding the child, doing all the stuff from scheduling the from rehab and things like that, taking me to rehab. A lot of those videos don't show the behind the scenes stuff. And for me, the reason why I owe her everything is because she's been there through me there for me, I'm sorry, through all this low point, truly this whole low point. And is again, when I say a pillar, she has truly been a pillar to everything in this relationship and for myself.
Wow,
Man,
that's a
that's not easy
testament.
though. It really, I mean, we have good days and bad days,
Yeah.
and obviously he's still himself, and there's a lot of people that they aren't themselves, and we are luckier than most in terms of that even though it was, like three different areas of his brain affected and it was such a massive hemorrhagic stroke that like cognitively,
Yeah.
and like his memory, like those things, we don't have those problems that a lot of people do have. It's more
Mhm.
just the physical ailments and those limitations. So, my husband's still in there, and you early on, I saw glimpses of him, and obviously being a provider, I think that at that point it was more let's get you better so then you could be happier too. Like and like everything would be better as well. And over time he's gotten more back to himself and getting back to being able to help more with our daughter and do more things with her and just be the dad that she wants him to be and that he used to be before all of this. Um, he's definitely that person now, and we actually are expecting I'm actually due like next month. So yeah, things are,
Congratulations.
thank you. Thank you.
Thank you.
We're definitely luckier than most though. I just think that you always have to ride the waves together, the highs and lows, and there's always going to be that in marriages, whether you have gone through a stroke or not. It's just a different type of challenge.
Well, it's fantastic that you handle it that way, right? It's just another one of those things through marriage that you've got to go through. But the whole better for worse thing seems to certainly be coming through here for you guys. You've definitely taken that piece of the oath to heart. And congratulations again. It did cross my mind. I was wondering if there was an addition coming soon, and so it sounds like it is very soon.
Very soon.
Yeah. Now, are you prepared from that from a health standpoint, Logan? Are you ready? Because it's going to be a very different experience this time.
I feel like I'm ready. I'm very anxious. This is a different time again. I am a
Mhm.
stroke survivor, so there are some hand limitations and things like that. That while I do have hand movement, it's like more like one and a half hands right now.
Yeah.
So I can change diapers. I can assist with that. Obviously, fully, I've got full hand function on my right side. Um, Again, like I'm able to perform a lot of the activities now. It's just keeping up with a 2-year-old and a an infant at this point that is a new thing and unknown territory for me. Dealing with Oakley, I was also very nervous and anxious then too, when
Mhm.
she was first born. So this is, I guess, in a way, is nothing new in some aspects. In other aspects, it's new. Um, do I doubt I will be a good father? No, I feel like I will be. It's just coming up and until I'm 100% recovered, dealing with those adaptations. And I have no doubt that I'm going to be 100% or at least 99.5, something like that. But
Yeah.
yeah, that's one thing
We've
that
been practicing those,
that's
so
another thing. Yeah.
and also I'm not the only one that gets to work with Logan these days. So I have kind of created a team here of other clinicians that kind of do things similar to me. We don't think in that neuro rehab box. We think outside the box and kind of do things creatively. And we've been doing things to simulate having an infant, carrying an infant, walking with an infant, picking up an infant, like doing all these different things that he's super hesitant for, getting up off the ground, holding, an infant, those sort of things that like he wants to practice, he doesn't want to mess it up, so we've been
Yeah.
practicing all that stuff. And in the video will see, you saw that he did this where the barbell was on his elbows.
Mhm.
He can hold the bar, like he can do deadlifts at this point, but we were practicing that because he'd be cradling the kid, our son, in his arms. So when he's doing that stuff, so we're just trying to do what we can to, I don't know, just very specific goal-oriented training at this point, just to make him feel a little bit more comfortable because I know it's nerve-wracking to add that extra layer of, just difficulty on top of everything.
Hopefully, you'll see an exercise soon when you see me coming up off the floor with a football in my hand
Yeah, we're working
and
on
doing
it.
that.
Okay. Well, I won't ask what that means about the gender, but I will let you.
Okay.
Although I was expecting to see some pictures of Oakley lifting some weights. I don't know. Is she in
Yeah,
training
she's got
yet?
some. Oh yeah, she's got her own little barbell, and I've actually put like real weight on it, and she does like shoulder presses and everything. It's cool to see that it's normal for her to hang out in the gym and see mommy and daddy taking care of themselves and their bodies, and she's like, this is what they do, so this is what I do for fun too. So she's really picked up on just taking care of herself through movement, and I think that's really cool to see too.
I am sure it is. I would love to see those pictures. I'll have to reach back out. We have a lot of questions coming in, and I want to make sure that we get to some of those. So, I want to just take a few minutes and go to those. I also want to encourage people who want to ask a question to please drop it into the box down at the bottom, the Q&A box specifically. So I will see those. And I have one more question before I'm going to turn over to these because I wonder now, Stacie, if this has changed how you work with your clients, your athletic clients. So going through this experience, understanding and incorporating the neuro component from your work with Logan, how has that changed what you're doing with your clients?
I think that I don't even realize how much it's changed because I feel like I'm a better clinician now. And obviously you get better over time as long as you're like, challenging yourself too and your thought processes. But I think I just naturally now incorporate more things that like I found are helpful to like just to get that mind body connection back. So we'll do more like the blaze pods or like some of the reactive training, kind of incorporating that. One, it's fun. It doesn't feel like rehab and therapy. So I do that a lot more often. And just also I look at things from more of a systemic, like a whole body perspective. So I
Mhm.
was able to catch recently that somebody is more like a vestibular or some sort of vertigo issue, rather than like an orthopedic issue. And I think that now I went to vision therapy with him like every day. Like, so I get to see some of these things in action. So, like, what I've learned from just observing him working with other individuals too, I will apply it to my own patients. And whether that's a neuro patient or an orthopedic patient, it's yeah, it's definitely cool to see how I can carry over some of those things because it's like all encompassing. You got to do what's best for each patient in front of you. And sometimes it is to go back to the basics and like do electrical stimulation or functional electrical stimulation to like get that mind body connection. And we do that a lot in ACL rehab, but we didn't do that a lot in other types of rehab. And now I'm starting to do that more with other patients as well.
One of the things that's coming through is the individualized treatment that you're using and you're consistently talking about, right? You worked on it with Logan. You're talking about that through your patients, which I think is so important with neuroplasticity-based principles in care. It has to be individualized to that person, and that's why one of the reasons why it takes so much longer to experience that because you're rewiring, you're rebuilding, you're regrowing all of those neuronal pathways in your brain, and it takes that repetition and the discipline that you were talking about, Logan. Whether you feel like it or not, you have to do that work if you want to see the progress. And the program that you've developed really just follows those principles: intensity of focus, repetition, and the purposefulness of it, doing it with a directed intent and outcome of it. So the alignment for what you did, whether you knew it or not, was perfectly matched with a neuroplasticity based program. So let me see. I've got quite a bit of, like I said, questions here. And Logan, this one is for you. It's about neuro fatigue. What were you, how much neuro fatigue did you feel, and what did you do to help that?
As far as neuro fatigue.
Yeah. Remember how when you used to get like really tired?
Yeah. You know, some people might be against it. I did have some caffeine here and there. Other times, you know,
Sleeping.
there
A lot
was
of
sleeping. But as far as when I started work, obviously I can't just go outside and take naps. It was you know, I really don't have anything other than really naps. I'm sorry I couldn't help more with that. It was over time, I felt like the neuro fatigue has sort of developed itself and it's gotten better and progressed a lot. Initially, uh, without knowing my past, I used to sleep like 4 to 6 hours a day. I
Mhm.
felt best there. After the stroke, I must have slept 10 to 12 hours a day, plus naps and things like that. Um, as it's progressed now, I sleep like 6 hours a day, 8 hours a day, and then, I do fatigue after a while. I try to take advantage of it with maybe some quick like meditation exercises. Really just being able to focus on myself and stay in quiet rooms and things like that, whether it be going to sit in the truck or whatever that be at that point. Again, I try not to take naps now. I just try to rest however I know best I can,
Mhm.
and then get back to it. Just keep getting back to it. Obviously, if I felt it was creating a lot of issues, as far as cognition or physical issues, then I would stop and take another break. But I wouldn't necessarily, I guess, rest my eyes. It would be more so just stick to myself, just center myself, do whatever I can, and keep going from there. I wish I could be more helpful with that one.
I think you just met
No,
your
I think
speaker
that is
with
very
that.
good.
Yeah, he would rest when he got tired, and it didn't mean sleep. It sometimes just meant like, just not doing anything but just like zoning out while he's watching TV or you know what I'm saying? Just nothing that was like overly stimulating, going into a quiet room. So I just think that he just listened to his body more so than trying to like keep pushing, especially early on. And now, he does keep pushing because then he's trying to develop a little bit more like immunity to being tired and being able to get more hours out of the day. But when he's tired, definitely at the end of the day, you can just tell that it's like he's tapped out and he's ready to go to sleep.
Mhm.
Yeah, you're done. It's time for some quiet time. A lot of what we talked about yesterday was the power of exercise in addressing that fatigue by oxygenating your brain and blood flow. So I would imagine that that played a significant role here as well because Stacie would just not let you sit still.
No, I had a whole
It,
checklist for
it
him.
played a huge role. I can't tell you how many times at first, like the amount of just the physical effort is so tiring initially.
Mhm.
And without that working out, I don't fatigue nearly as fast, but I wish you could see some of the videos I saw too. Just walking in certain ways would just get you so winded, out of breath,
Mhm.
or balancing was out of breath, or neurologically. I can tell you that there were points where I just felt exhausted, but I wasn't breathing hard.
Mhm.
Now, you're right. Exercising made a huge difference in how that
Mhm.
goes, not only from a mental aspect, physical aspect as well.
And you had a good baseline though, even before
Yeah,
this. So that
yeah,
obviously he could rely on some of that, which is
yeah.
why I'm such an advocate for continue to keep strength training as much as you can and keep working out because you never know when you're going to need to, fall back on that and rely on that. And not just from him, but for me as the caregiver, because I couldn't work out as consistently when he was in the hospital and stuff like that. So if I wasn't as strong as I was, then I wouldn't have been able to help him as much as I did.
Yeah. And so the message there is work, build your body and be healthy so that you can overcome
Mhm.
some sort of traumatic injury like this, a stroke,
Hmm.
and then continue to take care of yourself through it and acknowledge and pay attention to your instincts.
Exactly.
Did one of the questions that we had here is around the other types of tools that you use outside of just the simple physical therapy and movement. You mentioned eSTEM. Was there anything else in there that you utilized as a tool?
Yeah, so I started doing blood flow restriction training really early. I think I saw someone ask about katsu training.
Yeah.
That's what it used to be called when like tourniquet-based training. Now, we call it blood flow restriction because there's just a million different types of devices that you can use. So I'd been doing this for over a decade, actually probably even longer. So I knew that how important it was to help improve muscle wasting and atrophy. And he lost, how many pounds did you lose in the hospital?
Oh my gosh, went from like 220, and she says it may be a little bit more, but I think I remember this because it was appalling to me. I went from 220 to 164 pounds.
Yeah, they didn't. I mean, he was
Wow.
on a vent for 4 weeks and he didn't get his NG tube out until 2 days until we left inpatient rehab. So 7 weeks. So he wasn't allowed to eat, and so he lost so much weight. Obviously, he was on a paralytic agent too, because for his lungs, because he had all those other complications. So his muscles had just shriveled up. Like, compared to like who he used to be. And so I was
Mhm.
like, oh, we got to do something about this because the strength is the prerequisite to function. So I brought in my BFR stuff. I asked the doctors. The doctor goes, well, I don't really know about that. It's brand new. There's not enough research on it. And I just was like, okay, like I'm gonna politely say like you're wrong, because I've been doing this for over 10 years. I'm certified and like in orthopedic rehab, it is incredibly valuable and there's tons of research. Like it's one of the
Yeah.
most researched things nowadays. So I'm like, I can just apply the same principles there to neuro rehab. And we just started doing things in the hospital. We started doing that early on. The stem, functional stem, like I said, we bought that. We also bought one of those gloves, the robotic glove,
Mhm.
to be able to help him like open and close his hands. So we did that. Just anything to just try to like improve movement or just get him to start doing a task with that. We did that definitely early on, and we still do that to this day. What else have we done? I bought a lot of stuff over time. I feel like that was also the thing. Like you don't know what's gonna work and what's not gonna work, and obviously insurance doesn't cover all this stuff. So I was like, okay, well we just have to like try it because what if this is like the thing that makes the biggest difference? So we've tried just so many different things over time, but I think the biggest thing that we've realized is just the strength training, just the being consistent with the strength training and um, having very goal-oriented tasks. So then he gets more out of it and feels I don't know, like he likes it a little bit better.
Did you have aphasia, Logan? Was that part of your challenge?
Yeah, I
Early on.
did. I did. It was more so in the initial beginnings,
Hmm.
and after a while, I think it really helped when we had the what was that woman? She was respiratory
Respiratory
therapist.
therapist.
Yeah, she worked with my breathing, which actually helped a lot with my voice
Hmm.
and my enunciation. Speech therapist also while I was there that helped with the cognition of aspect. Which seems counterintuitive to me in a way. Speech therapists and she's teaching me how to use a calendar and things like that.
Yeah,
But
the speech
even
therapists,
still,
they're
yeah.
incredible. Like
Oh
they are
yeah.
like the catch-all for anything that the
Yeah.
OT and the PT doesn't do. I had no idea the broad span that they cover, but
Mhm.
he didn't like her because she didn't let him eat, but
Yes.
um,
Oh,
she helped a lot with
yeah,
that stuff early on because he had quite a bit of aphasia early on.
I did. I did.
And then also just like problems with thinking clearly or with attention span or with
Hmm.
tracking and stuff like that. So he had a difficult time finding, words on a paper or trying to like complete the task verbal versus like written. So yeah, he had a lot of that
Yeah.
early on, but not, I mean, you did like 12 weeks of speech therapy in outpatient
Yeah, yeah. I
or
think it was.
something.
I think it also was the impulsivity of it too
Oh
that
yeah.
contributed to it. But yeah, but
Yeah.
all of that, what helpful contributing
Hmm.
factors was again speech and respiratory therapy. Hmm.
And do you feel like you're back, Logan, with that? Have you 100% recovered with the
Like I
aphasia and
said,
with the cognitive?
if I was 100% recovered, I guess I would have full hand movement back. But I've got strength back.
But
I,
cognitively.
cognitively, that aspect, yeah, I feel like I'm there. As far as that goes, from a physical aspect, I keep using that as my
That's
final reason, my
yeah.
final thought for doing
That's
that.
a
But cognitively, I don't know that. Again, I think I was blessed that I didn't have a lot of that wrong with me. Um, speech, yeah, I didn't. I don't think I had a ton after a while of working with it. I think it's back to 100%. Yeah.
Good. Amazing. Yeah, that's fantastic.
Mhm.
There's a question here about how do you find a good balance as a caregiver? Because if anybody's got the experience and the knowledge to be able to debate with a caregiver on what's right or wrong about this, it was you, Stacie. So, what advice do you have for individuals who are interested in trying some of the things they learn about either here or elsewhere, and their physician doesn't know about it? How do you handle that in a way that's productive and not confrontational?
yeah. Some of that's challenging too, because I mean, as a clinician, sometimes in certain regards, like you said when you first introduced everybody today, that there's so much research and everything is always evolving. You can't possibly know everything about everything. And so since I'm like specialized in this area, I know a lot about this area, and so um presenting different research articles, like I would share different things or just like ask questions that they seem surprised to be asked by somebody like, oh, I never thought of it that way. So I think that the first step is just turning the light bulb on in their brain, because if you think that this is completely the wrong way to go, you're going to just shut it down right away. But if you can just kind of like, start talking about it and plant the seed and then like slowly start like dropping like information about it, I think that's kind of the way to go, because people don't want you to go in their space and step on their toes or like tell them what to do and how to do it. So it's how to politely do that. And I feel like sometimes early on I came across pretty harsh because I was like, listen, like I know this is beneficial, and they probably thought that I was rude for like just being really like confrontational and just telling them that like I didn't say you're wrong, but I was like, actually, like that we're gonna still do this because I know how beneficial it's gonna be. Um, so I wouldn't go about it that way. I would definitely go about it more of like a, let me just give you information, and then ultimately, if you decide that that's what's best for your loved one, then you can try it. But we would always do different things, and I would always check his blood pressure. And so we'd monitor that like before and after these new interventions, just to make sure that there was no spikes in blood pressure, because that's what they thought ultimately caused his stroke to happen. Because he was completely healthy prior to that. Like nothing else explains it at all. So the blood pressure thing is something that we've always constantly been keeping an eye on too. And so that's how I would know, like, is this causing some sort of problem in his system, and it physiologically, and just going from there. But those are hard conversations to have. I feel like it's also hard to be the caregiver and to be the provider, to try to wear both hats too. And sometimes you got to realize like when he's having a frustrated day and I'm like, just do 5 more reps, or like, that's probably not the time to like push the envelope at that point. And so from a loved one's perspective, it's good to be able to switch gears and just be like, you know what, it's not that important today. We'll pick up tomorrow, sort of thing. Because I mean, this is your loved one, and obviously, it's not worth it to keep arguing about those things.
Yeah. I and the emotional piece, there's another couple of questions here around depression and the recovery and the role that that played. And I know that had to be, you've sort of alluded to that a little bit, Logan, that, there were those days where you just couldn't get over the hump, but you pushed through anyway. What would you say was the best tool that you used to get over the depression that you had? And how did you master that up front? So you wake up, you're in this situation, and you know you've got a long road to recover. You've got an infant to take care of. Your wife is no longer now able really to work because she's with you. And how did you wrestle with all of that and not get bogged down in the depression?
I believe it became a habitual that I would actually try to work out certain weaknesses too. And seeing that I could not only just accomplish one of those goals, but if not, I may progress to another challenge, more progress. Again, Stacie was really good about establishing small goals intermittently and also smaller ones just that I can meet one at a time. And it's one of those things that when I was feeling especially down with that, and this is not something I don't know that'll work with everyone, but for me, it's just getting out and doing something, working towards those goals, and just trying to see what I can do as far as that goes. Now, necessarily, like it's got some. There's a downside too. Like if you don't meet them, for some people, it
Mhm.
might be a downer. But for me, I chose to look at it as more progress to
Motivation.
a certain goal. Yeah, motivation. But again, those accomplishments, those little accomplishments, sorry, I'm out of breath, you make is one of those things that it really, man, it kind of gets you really ready to go again. Is those hitting even the littlest accomplishments. Like, for example, when I would reach for something and I would reach into certain synergy patterns, I would flare my elbow out. When I went to reach the steering wheel or something like that, all of a sudden my elbow wouldn't flare out. That was huge. It's huge.
Mm.
For whatever reason, it just was. Just continually trying to
Mhm.
meet those small goals in whatever way they can. And I don't know why, but the initial meeting I had about it said celebrate the small goals. I was like, this is complete crap. I don't understand this. I really don't get this. I'm starting to get it now. Celebrating those small goals in whatever way. And it makes me want to go more and more as soon as I can, stuff like that. And yeah, you won't meet everything all at once, but it's the way to really find yourself a route to keep continuously going and get yourself out of this funk that you're in.
Mhm.
And that's why keep saying too, like there was depression, a lot of it at some points, but
There still is.
there is at points. There is still some points of that. But really reaching and constantly trying to meet those goals has been essential.
Mhm.
Yeah.
Talking about it. We've been trying to talk about things too, like, here and there. Sometimes he's not ready or willing to talk about it, but,
Mm.
he doesn't talk about it with anyone else too. So I think that that's important. Like when he's ready, I'm here to listen too. And because there's a lot of thoughts going on in that brain, like I can't possibly know everything that he's thinking. And that's why it's really important also just, professionally talk to somebody if that's something that's really weighing on you.
Yeah, thank you. We have time for one more question, but before I do that, I want to ask everyone to please take a minute and do the poll that's just popped up in front of you. Let us know how valuable the session was to you personally, whether you felt inspired, and give us your feedback so we can use that to improve what NPA shares going forward in the future. So the last question, and I really want to leave this with you to be able to close out the day, Stacie and Logan. I want you to just share one last piece of advice for our audience today. If you find yourself trying to recover from a stroke yourself, or whether you're giving some care to someone, what is the last piece of advice that they should do right now today?
Oh gosh. Um, I mean, find the right people that believe in you and maybe think outside the box. Because I think that we all have our own strengths. Just like, if you work with a personal trainer, or a normal physical therapist, like not every physical therapist is the same. but there are some amazing ones. And also, you don't necessarily always need a physical therapist to be able to help your loved ones or yourself. I think that just finding the people that like just aren't willing to give up is the first step and are willing to try anything to help you get better. That's what's really most important because even strength coaches, they're phenomenal. They know how to get people strong. And if the strength is the big goal, go to them, like just find the people in your community that can, in your village, that can really help you get to your goals and rely on your people. Like, I can't know everything. I definitely did not do this by myself. He had different people that he worked with in outpatient therapy that I still correspond with, and I ask them questions. And it's so nice to be able to have them as, those people that I can ask questions to that I rely on because, we don't have time to drive all the way it was an hour each way to go to therapy for him, which is a long time, a long drive. And, he would go there 3 times a week. So at a certain point, I feel like most people discharge because it's like, okay, they've hit that year mark, or, all the research says the first year is where all the progress occurs. But, I would still keep figuring out ways that you can progress and keep doing physical therapy. If you're somebody that's a stroke survivor, that you're past that year mark, keep going. Neuroplasticity is always available. It's always happening. You can always get better and you rewire things and figure out ways to move and reach your goals. You just got to be consistent at it. And so taking time off is not the answer, but maybe just finding another route to help you get to your goal.
Thank you. And that is a perfect message. I appreciate you saying that because our very next speaker is going to talk about never give up and don't let the timeline be your barrier. So thank you guys for joining us so much today. Congratulations on the new baby coming your way. Logan, we
Thank you.
really want to continue to watch your progress. I know you're going to be ready to do all of the things correctly and hold that baby and be in great shape to do that. So I love how you've been specifically training for those movements. You guys have been a tremendous inspiration, and we thank you so much for sharing your story. And last thing, real quick. PhysioFix is in Arizona, correct?
Yeah, Phoenix, Arizona.
Phoenix, Arizona, and you can find Stacie's online programs there. So please go to PhysioFix, and if you want more information, and if you want to hire them, I think that to do
We
your
work with people all across the world. I'm not even kidding. Ever since that he had his stroke, we've been helping people that have had strokes as well across the world. And we can do that through online training and programming. So it's kind of incredible, but if that's the best provider in your area or like, that you have access to, like give us a try. We will not give up on you.
Yeah, you find your people. Like to take your
Yep.
message out. Find your people. Okay,
Yep.
thank you so much.
Thank
Thank
you.
you.